bill, SB239, we have a public hearing on that. Would you pass, do you have the information for committee members? Okay. Okay. Yeah, but what you printed off for them. They've all got them. They've already got them? Okay, good. So we'll have a public hearing on this bill, and here's what we're going to do. We've got a distinguished guest with us today who's the new executive director of the Board of Medical Examiners. I'm going to explain what the substitute does. Then I'm going to recognize Mr. Perkins for his comments, and I told that side of the issue they could have 10 minutes, but I think he may not be taking 10 minutes, but you can if you want to. And maybe out of fairness, I ought to explain the bill first, and then you can come back and rebut, and you get the last word before we go into it. Does that sound okay with you, Mr. Perkins? Is that fair enough? Okay. So, committee members, you have this document in front of you. Senator Melson is accusing me of spreading propaganda. Okay, has everybody got this? There you go. Okay, looks good. So I'm going to go through this, and this is really going to be my presentation on this bill. Page 1, upper right-hand corner, these things are numbered so I can keep them straight. You all have received a substitute. It's a 9-page bill. I think the original bill was 101 pages. What I have done to make life simpler and easier to understand for everybody is taken a lot of the issues out that was objectionable, and I've left 3 issues. But so if you'll go, page 1 simply says the Board of Medical Examiners is an agency of the state of Alabama. However, the members are selected by a private organization. That is very unique in Alabama. In fact, the only other example I can think of that is the Board of Public Health, and this committee's already dealt with the Board of Public Health to get them selected in a different manner. So today, all the members of a state agency are selected and controlled by a private organization. Page 2. All of you in the Senate have seen this list before. Basically, Massa's Board of Censors is made up of the same people as the Board of Medical Examiners, which is the same people as the State Committee on Public Health. So the column on the right, we're dealing with that with, I guess it's Bill 240, SB 240. We're on the column in the middle, and that's the Board of Medical Examiners. So you see they're all the same people. They're all selected by the Medical Association, which is a private group, is a dues-paying group. Page 3. I put this in there because it's kind of interesting. I guess I'll read it. If I give myself 10 minutes, I'll take it. This came out of a lawsuit that was unsuccessful. Dr. Melson pointed that out to me yesterday, that the lawsuit was unsuccessful, but I think this statement is factual. On Wednesday, September 27th, and this was 2017, Department of Public Health held their customary monthly board meeting. Then the same people moved over to the Medical Association and had their customary monthly board meeting of the Board of Censors. And then that same group walked over to the State Board of Medical Examiners, who we're talking about today, and had their customary State Board of Medical Examiners meeting, all 3 board meetings involving the same people. I think that tells you a little bit about where my interest is in this and what I'm trying to do. The next page, page 4, is a list of health outcomes in Alabama. The total point of this is to show how well we're doing in Alabama with health care the outcomes for the patients that we have compared with the rest of the nation. As you can see, it's not good. Now, I'll point this out. The State Board of Medical Examiners certainly has a role in this. They're not 100% responsible because we have fat people in Alabama. We do. But this is not a good this is not a good reflection on our state, but it's the truth. The next page, page 5. This is one of the most worrisome things we've got to deal with in the state, and that's opioid prescriptions. Now, remember that prescription drugs that end up on the street for sale originate with a prescription. They're not concocted in the basement. They're not made in Coke bottles. Somebody writes a script. And if you look at this chart, it's very clear. This is CDC information, Center for Disease Control. It is very clear that Alabama, who is, by the way, the leading state in the nation for the number of opioid prescriptions per capita, by far. Not only are they the leading state, they have been for the last 7 years. You see, there's a trend here. There's a trend, but we're not close to our peers. The reason I use Georgia and Florida is because that's what CDC used in their example to make this point that I'm making here. It's up to the Medical Board of Examiners to take these licenses away. And we have a serious problem here. And I think one way to deal with that problem is to start at the top. You don't start with the drug dealer. You don't start with the people on the corner. You start with the people that are writing prescriptions. Last page, page 6. On the left side, under the current law, board members are chosen by members of a trade organization, Medical Association, State of Alabama. Under this bill, if it becomes law, all licensed physicians in the state of Alabama will get a vote, and they will help make the decision. And by the way, this is exactly the same way it's done with dentistry and optometry. They do the same thing. And this bill says, you got one per congressional district and a couple of statewide members. Pretty common way of doing it. The second thing the bill does, right now, the members from this state agency are exempt from the ethics law. They're not required to report. They've got an exemption that was put in place. I've got it in writing in 2009. This bill would put the State Board of Medical Examiners under the ethics law, same one all of us at this table are under. The third thing the bill does, it requires that the finances of the Board of Medical Examiners be made public, that they go online like every other state agency. Right now, I can go into Alabama's open checkbook, and I can see what the state of Alabama is paying Larry Stutz. See what it is. You put your name in there, and it pops right up. You can see what it is. If you try to do that with any member of the Board of Examiners of the Medical Association, it's not on there. They're not subject to that. And what I would like, I want to see where that money's going. They raise a lot. The Board of Medical Examiners has a huge budget. They raise and spend a lot of money. Some of it shows up in the sunset evaluation, but you can't find out what's happening with that money. Well, that being said, what I've done, I've taken a 101-page bill, I've condensed it down to 9 pages, and I've made that bill focus on only 3 things. How the members are elected by all the doctors, not just a few of the doctors. Makes them subject to the ethics law in Alabama, and they're not now. And it makes their finances a matter of public record. After all, they're a state agency. With that being said, I recognize William Perkins. We're honored to have him here.
Mr. Chairman,
And Mr. Perkins, thank you for your service as well.
Thank you, sir.
While he's coming up, I would like to get this on record with the bill, asking for a roll call vote, and then I want to address some other things of it after he gets through. Thank you.
Thank you, Mr. Chairman. Can y'all hear me? Thank this Health Committee for allowing me the opportunity to speak on behalf of the Board of Medical Examiners. I would have to agree with the chairman when it comes to the prescribing for our state. As a former, well, I still consider myself an investigator by trade. And since my short tenure, I have hired, I think, 5 additional investigators just to help to curb some of this prescribing going on within our state. With that being said, again, my name is William Perkins. For over 30 years, I have served the people of Alabama as a United States soldier, retiring as an officer, as a police captain, and also as an investigator with the Board of Medical Examiners, and now as the executive director for the board. I'm here today to speak in opposition to the bill. In the midst of a global health care crisis, in which I've been involved in since this thing hit our state here in February, this is a solution desperately searching for a problem, and it would upset a regulatory structure that has worked for more than a century. More than 18,000 physicians rely on this structure every day. Every hospital across the state relies on this structure. Thousands of physician assistants, nurse practitioners, and pharmacists rely on this structure. Not one stakeholder in all of the state of Alabama healthcare that I know of has approached me to say that we had a major issue or problem with the healthcare licensing and regulation within our state of Alabama. I know of any, and that's asking for this. In fact, in my brief 6 months tenure as the board, as the director, the Board of Medical Examiners has made great strides in working with our healthcare professionals and stakeholders. We have worked with the Board of Nursing to increase the ratio for advanced practice nurses to 9-to-1. We've also worked with the Board of Pharmacy, and we are doing that now. I've been in contact with their leadership, and we're now working on the past rules on pharmacy collaborative practice to implement this new type of practice. And I think Senator Butler, he shared my sentiments on that. We have even worked with education leaders to convene a group of healthcare and education stakeholders to discuss issues surrounding the COVID pandemic affecting our schools. For a while, we had superintendents didn't know what their own principals was doing, and I basically reached out myself to this educational group, and I formed a meeting, and we had a all-day discussion right here in Montgomery to get these stakeholders at the table to discuss our problems within our schools when it pertains to this virus. I'm gonna move on now. It won't take me 10 minutes. The current structure allows for the Board of Medical Examiners to serve as the investigative and prosecutorial arm of medical discipline. If charges are filed, the Medical License Commission sits in judgment. It's a fair system. It is comparable to the structure employed by the Alabama State Bar. The Alabama Board of Medical Examiners is known nationally as one of the most effective physician regulatory boards in the country. And if you allow me, Mr. Chairman, I know we always talk about that Alabama always lasts when it comes to certain things. Well, not this particular matter. When the virus hit, we had several states. We had already implemented our temporary license process. And I received phone calls from the state of Georgia, state of Oregon, state of Nevada, asking how did we get this lined up so quickly without really having information on how this virus was going to take place, and needing these additional physicians to come within our state in order to help with this pandemic. And I've been on the front lines since day one. And should this SB239 become law, the structure will be tossed out in favor of process, just favor politics over policy. This thing works great for what we're doing right now. I'm not a politician. I don't get into the rims of it. But I do know members of the board would be the investigators, the prosecutor, judgment, and jury if this thing passed. And we believe that structure is fundamentally wrong. Furthermore, in its current structure, the Board of Medical Examiners has had a long history of diverse membership. The current board is 25% female members and over 30% racial minority members. The restructuring proposed in this bill will prohibit this continued diversity and promotes a method for selecting members that has proven to hinder minority representation, which I'm included in those numbers, I have to say. There is language that excludes future board members from participation in various medical societies and organizations, and we want the highest caliber to serve on this board for our state. I think this bill may forbid that. The state of Alabama, at the end of the day, is charged with protecting the health and welfare of the people of Alabama, and we need to keep it that way. And with that, I reject this bill. On the board, the BME itself is 16 total members. 3 of those members are 3 African-American males, 1 Asian male, 1 Indian female, and 3 white females. So with my short time, if I'm allowed to continue with this process, I feel that God has placed it on my heart and in my wheelhouse to allow this process to get better. And that's it. If y'all have any questions for me, if I can answer, I'm here, sir, Mr. Chairman.
Thank you.
Mr. Chairman,
Thank you, Mr. Perkins. Senator Melton, I believe you.
I was just going to comment, the diversity part's great, but more importantly is the ability. It's a good mix, it's a good variety, and they function well. I will say that sometimes I get very frustrated with some of the aspects of it, but overall they do a great job policing, making sure we have qualified physicians that are disciplined when need to be disciplined, and the whole process just seems to work well the way it is to me. And again, to echo your comment, I'm worried we're going to go to politics instead of taking care of patients, and that's my biggest concern.
Thank you, Mr. Senator.
Senator Madison Coleman, did you want recognition?
thank you, sir. I'd just like for you to address the health rankings here. I don't know if you've seen this. And a lot of those adversely affect people of color as far as disparities. And so, and our rankings compared to other states and where we are, and what are you all doing to raise that level to improve the health care overall state of Alabama?
Well, I'm not a physician, but I sit at the table. I hear these, I see these reports. I get the investigation when they come in. I understand that our state is in a crisis when it comes to, you have over 36 different rankings here. And I can't speak to all of them, but I can speak with the when it comes to our change in drug overdose and death rate. I'm in the weeds when it comes to that. I'm whatever it's gonna take, whether it's meeting with not just our board, but with other boards that have some of the same problems. You mentioned that, and I think Mr. Chairman did also, that we were almost dead last. But I've went to the Federation of State Medical Boards and sit in attendance with the state of Mississippi, the state of Georgia, and those places. And the way that they report their rankings is, to me, it's a little bit more. I don't know the term to use, but they don't go as so in depth as we do for the state of Alabama when we report certain things. And it's not just these healthcare rankings, but other rankings as well. And I don't want to get off the subject, but I mean, we can take the industry when it comes to industrialized, the makeup of our industrialized programs within the state, when vehicle manufacturing, those things, those numbers are reported, so many different ways that if you're not at the table with an expert, I mean, everything can be misconstrued. Hopefully that answered your question.
Well, somewhat, and I know it's not something that you all can deal with right now. You can look at people. Are people getting better? Is the quality of health improving? And so, or not. And in a lot of cases, it is not. And so, to me, I don't know how you skew that. Either person is getting well or not. And that is a concern that I have. And again, I don't believe in policing or being the big guy to watch over the medical profession, because you all know more than I do about it. However, it takes both sides for you all working with us to help us to bring this up, because that's the focus of this health committee. And they don't see you all, they don't know who you all are, but they know who we are.
Yes, ma'am.
Thank you.
Yes, ma'am. Thank you.
And Senator Stutz is recognized, and then it will be Senator Gavan following Senator Stutz.
Mr. Chairman, thank you. I am really looking for a bill that you and I can agree on, but this one's not it. I do agree with you on the point about prescribing opioids, and I have long said that somebody is writing those prescriptions, and I could not agree with you more that when a drug problem is related to prescription drugs, the place to look is who's writing the prescriptions, and we agree 100% on that. But restructuring the whole board, I think that's throwing the baby out with the bathwater. I'm not at all opposed to looking at some things that might make some improvements. And in this list of diseases that we rank, I pointed out when we talked about the other public health bill in our last meeting that common factors of risk factors with obesity and other things hit every one of those things at the top part of that list, and we're not in charge of that. I'd love to see those things changed, but changing the makeup of these boards is not going to make an impact in those areas. But anyway, I appreciate you bringing the bill. I'm glad to work with you on making some constructive changes, and agree with you on the opioid prescriptions 100%, but not on the entirety of this bill.
Senator Stutz, thank you. Senator Gavan.
Thank you, Mr. Chairman. So I kind of want to follow up a little bit about what Senator Stutz said. I mean, my doctor has told me for 20 years to lose weight, and I finally listened to him last year. So, I mean, they're not in control of this. We're in control of this. And I don't think that they should be held responsible for what the failure of the society, which there can be many reasons for all that they're not placed on the medical community. I like where you're moving with this, but I just cannot get comfortable with a substitute with this for something that's been in place for over a century on such short notice. So I'm going to have to vote no.
All right, looks like we've covered it. So here's what I'm going to do with Senator Beasley.
Thank you very much. I'm concerned about on the opioid rate as well. Do we have pill mills in Alabama?
Well, I'm not going to sit here and sugarcoat it. I think we do, but we're fighting that every day. Matter of fact, that's why I brought these additional resources in just to cover these areas, and I got some experts here. I got a matter of fact, I have an office in Birmingham now that has just taken off here in the last 12 to 18 months, and we're going to cover north and south and the middle part of the state, and I can guarantee you, I'm going to be right there with them. I promise you that.
If there's a heavy utilization by any particular drugstore in the state of Alabama, then the prescribers in that immediate area you would think would correlate with the high usage of opioids.
Yes, sir. And with having the prescription drug monitoring program, I think it's going to play another vital role to what we are trying to get out of this.
All right, Mr. Perkins. Are you Mr. Perkins? Is that appropriate? Is that proper? Or are you?
So you can call me anything you like.
No. I want to call you. I want to call you what's proper.
Sir, well, you can just call me William or Mr. Perkins or whatever you like.
Okay, Mr. Perkins, it'll be.
Chairman.
Okay, wait just a minute now. Let's get over here and get Senator Milson.
Well, it kind of like Senator Gavan said, your whole job is to make sure that the physicians are competent, and you can't make the patients compliant.
That's correct.
So the personal responsibility, I think, is probably the vast majority of this, or poor genetics, and or a combination, which many of us kind of display here. But that being said, I just want to say thank you for coming. I appreciate the job you do, and thank you for your time.
Senator Butler.
Thank you, Mr. Senator.
Thank you, Mr. Chairman. Mr. Perkins, I want to commend the examiners that are operating with the Board of Medical Examiners. As a pharmacist, I have, and I know Senator Beasley has too, most pharmacists do, occasionally run into physicians that are overprescribing. I've had a lot of patients come into the drugstore that have been 100, 200 miles away to come back with a very large opioid prescription. And after checking those out, a lot of them we refuse to fill. If the physician is not practicing within his scope of practice, I'll give you an example. One we had down in, I'll call it Southeast Alabama, won't name the town, but was actually a pediatrician that was writing opioid prescriptions, and I picked up the phone and I called the Board of Medical Examiners. I talked to, can't remember his last name, Jim. But you know who I'm talking about. I think he's retired, but they got on it right away. He's the one that informed me we've got a case pending on that, and he gave me the details of who the physician was and why he should not be writing those kind of prescriptions. So I want to commend the board for what they do, working with pharmacists when we have a problem dealing with opioids. That's a huge national problem. It's actually an international problem. But a lot of physicians do not write opioids. There are pill mills are operating, but when the Board of Medical Examiners, DEA, all of those involved, find out about them, they do something about them. I know we had one in large operation in South Alabama, and those two physicians are now in prison, and that practice has been closed down. So the pharmacists and the physicians working together with the board and the examiners there do a wonderful job. So thank you.
Thank you, Mr. Senator.
Okay, that being said, I think we've wrapped it up. Now, here's how I want to do the rest of this to be fair. I'm going to do a few brief rebuttal type statements that are made. Then I'm going to offer the microphone back to Mr. Perkins to do the same thing if he feels the need. And then we're going to have a roll call vote, and we'll be done with it. That good with everybody? So here's my comments, and responding to what Mr. Perkins made. First, we're the only state that allows a private group to elect and control the state agency. Secondly, this bill does not affect the Licensure Commission at all. It's not mentioned in the bill. That would be up to the members of the Board of Medical Examiners to. That's who created the Licensure Commission, and that would be their authority. Accusations taking the politics out of this, well, I disagree with that, simply because right now it is definitely political in that these members are chosen by an advocacy group. And what the proposal that you have before you under 239 is that all physicians, all licensed physicians, participate in the selection of these people, not just a small group. And probably one of the most important things we all need to understand, and I may have to disagree with Senator Butler, who feels like we're doing a good job. The job of the Board of Medical Examiners is to protect the public. It is not to protect physicians. It's to protect the public. And all you have to do is look and see that in Alabama, for the last 7 years, we're the leader in prescriptions per capita in the nation. That is not protecting the public. The only way I know to do something about that is make some changes at the top. And that's what this bill does. Now, if this bill comes out of here and Dr. Stutz comes up and says we need 7 members on this board, I don't have a problem with that. I would just like for all licensed physicians to have a voice in electing those people, and those that are qualified have the opportunity to serve as the Board of Medical Examiners, just like it is in optometry and dentistry. With that being said, Mr. Perkins, you get the last word.
Okay, and I'm going to be very brief, Mr. Chairman. Just in the past, I want to say 2 months since we've been doing a lot of this virtual meetings. I had 3 states. I'm not going to name those states, but they somewhat envy our setup because they are. If if they could change their current system to operate the way we operate now in Alabama, I think they'll do so. And thank you for your time, Mr. Chairman, and this great health committee.
Here's where we are. We have a sub before us, and I'll make a motion to adopt the substitute. And that motion is seconded by Senator Convan. Do you all want a voice vote on that and just get the substitute before us for a final vote, or do you want me to call a roll? Call the roll.
Senator McClendon.
Aye.
Senator Beasley. Senator Butler.
No.
Senator Chasteen.
No.
Senator Coleman Madison. Senator Gavan.
Aye.
Senator Gudger.
Aye.
Senator Melson.
Aye.
Senator Roberts.
Aye.
Senator Stutz.
Aye.
Senator Watley.
Aye.
Senator Williams.
8-4, the substitute is adopted. We now have us before the substitute, and we'll call the roll on final passage of SB239 as substituted.
Senator McClendon.
Aye.
Senator Beasley. Senator Butler.
No.
Senator Chasteen. Senator Coleman Madison. Senator Gavan.
No.
Senator Gudger. Senator Melson.
No.
Senator Roberts.
No.
Senator Stutz.
No.
Senator Watley. Senator Williams.
No.
And the bill is not given favorable report. This meeting is adjourned, and I want to thank everybody that took time out to come here and help educate the health committee. Thank you all. We'll meet in 2 weeks.